Section 41 of Anatomy of the Human Body, Part 4. This is a LibriVox recording. All LibriVox recordings are in the public domain. For more information or to volunteer, please visit LibriVox.org. Anatomy of the Human Body by Henry Gray, Part 4. The Sacral and Coccygeal Nerves. Nervi sacralis and coccygeus. The anterior divisions of the sacral and coccygeal nerves, rami anteriores, form the sacral and pudental plexuses. The anterior divisions of the upper four sacral nerves enter the pelvis through the anterior sacral foramina, that of the fifth between the sacrum and coccyx, while that of the coccygeal nerve curves forward below the rudimentary transverse process of the first piece of the coccyx. The first and second sacral nerves are large. The third, fourth, and fifth diminish progressively from above downward. Each receives a gray ramus communicans from the corresponding ganglion of the sympathetic trunk, while from the third and frequently from the second and the fourth sacral nerves, a white ramus communicans is given to the pelvic plexuses of the sympathetic. The sacral plexus, plexus sacralis. The sacral plexus is formed by the lumbosacral trunk, the anterior division of the first, and portions of the anterior divisions of the second and third sacral nerves. The lumbosacral trunk comprises the whole of the anterior division of the fifth and a part of that of the fourth lumbar nerve. It appears at the medial margin of the psoas major and runs downward over the pelvic brim to form the first sacral nerve. The anterior division of the third sacral nerve divides into an upper and a lower branch, the former entering the sacral and the latter the pudental plexus. The nerves forming the sacral plexus converge toward the lower part of the greater sciatic foramen and unite to form a flattened band, from the anterior and posterior surfaces of which several branches arise. The band itself is continued as the sciatic nerve, which splits on the back of the thigh into the tibial and common peroneal nerves. These two nerves sometimes arise separately from the plexus, and in all cases their independence can be shown by dissection. Relation. The sacral plexus lies on the back of the pelvis between the piriformis and the pelvic fascia. In front of it are the hypogastric vessels, the ureter, and the sigmoid colon. The superior gluteal vessels run between the lumbosacral trunk and the first sacral nerve, and the inferior gluteal vessels between the second and third sacral nerves. All the nerves entering the plexus, with the exception of the third sacral, split into ventral and dorsal divisions, and the nerves arising from these are as follows. Nerve to quadratus femoris and gemellus inferior, ventral divisions, fourth and fifth lumbar, first sacral. Nerve to obturator internus and gemellus superior, ventral divisions, fifth lumbar, first and second sacral. Nerve to piriformis, dorsal divisions, first and second sacral. Superior gluteal, dorsal divisions, fourth and fifth lumbar, first sacral. Inferior gluteal, dorsal divisions, fifth lumbar, first and second sacral. Posterior femorocutaneous, ventral divisions, second and third sacral, dorsal divisions, first and second sacral. Sciatic, tibial, ventral divisions, fourth and fifth lumbar, first, second, and third sacral. Common peroneal, dorsal divisions, fourth and fifth lumbar, first and second sacral. The nerve to the quadratus femoris and gemellus inferior arises from the ventral divisions of the fourth and fifth lumbar and first sacral nerves. It leaves the pelvis through the greater sciatic foramen, below the piriformis, and runs down in front of the sciatic nerve, the gemelli, and the tendon of the obturator internus, and enters the anterior surfaces of the muscles. It gives an articular branch to the hip joint. The nerve to the obturator internus and gemellus superior arises from the ventral divisions of the fifth lumbar and first and second sacral nerves. It leaves the pelvis through the greater sciatic foramen, below the piriformis, and gives off the branch to the gemellus superior, which enters the upper part of the posterior surface of the muscle. It then crosses the ischial spine, re-enters the pelvis through the lesser sciatic foramen, and pierces the pelvic surface of the obturator internus. The nerve to the piriformis arises from the dorsal division of the second sacral nerve, or the dorsal divisions of the first and second sacral nerves, and enters the anterior surface of the muscle. This nerve may be double. The superior gluteal nerve, nervus gluteus superior, arises from the dorsal divisions of the fourth and fifth lumbar and first sacral nerves. It leaves the pelvis through the greater sciatic foramen above the piriformis, accompanied by the superior gluteal vessels, and divides into a superior and an inferior branch. The superior branch accompanies the upper branch of the deep division of the superior gluteal artery and ends in the gluteus minimus. The inferior branch runs with the lower branch of the deep division of the superior gluteal artery across the gluteus minimus. It gives filaments to the gluteae medius and minimus, and ends in the tensor fasciae lati. The inferior gluteal nerve, nervus gluteus inferior, arises from the dorsal divisions of the fifth lumbar and first and second sacral nerves. It leaves the pelvis through the greater sciatic foramen, below the piriformis, and divides into branches which enter the deep surface of the gluteus maximus. The posterior femoral cutaneous nerve, nervus cutaneus femoralis posterior, small sciatic nerve, is distributed to the skin of the perineum and the posterior surface of the thigh and leg. It arises partly from the dorsal divisions of the first and second and from the ventral divisions of the second and third sacral nerves, and issues from the pelvis through the greater sciatic foramen below the piriformis. It then descends beneath the gluteus maximus with the inferior gluteal artery and runs down the back of the thigh beneath the fascia lata and over the long head of the biceps femoris to the back of the knee. Here it pierces the deep fascia and accompanies the small saphenous vein to about the middle of the back of the leg, its terminal twigs communicating with the sural nerve. Its branches are all cutaneous and are distributed to the gluteal region, the perineum, and the back of the thigh and leg. The gluteal branches, nervi cluneum inferioris, 3 or 4 in number, turn upward around the lower border of the gluteus maximus and supply the skin covering the lower and lateral part of that muscle. The perineal branches, rami perineales, are distributed to the skin at the upper and medial side of the thigh. One long perineal branch, inferior pudendal, long scrotal nerve, curves forward below and in front of the ischial tuberosity, pierces the fascia lata, and runs forward beneath the superficial fascia of the perineum to the skin of the scrotum in the male and of the labium majus in the female. It communicates with the inferior hemorrhoidal and posterior scrotal nerves. The branches to the back of the thigh and leg consist of numerous filaments derived from both sides of the nerve and distributed to the skin covering the back and medial side of the thigh, the popliteal fossa, and the upper part of the back of the leg. The sciatic, nervus ischiadicus, great sciatic nerve, supplies nearly the whole of the skin of the leg, the muscles of the back of the thigh, and those of the leg and foot. It is the largest nerve in the body, measuring 2 centimeters in breadth, and is the continuation of the flattened band of the sacral plexus. It passes out of the pelvis through the greater sciatic foramen, below the piriformis muscle. It descends between the greater trochanter of the femur and the tuberosity of the ischium, and along the back of the thigh to about its lower third, where it divides into 2 large branches, the tibial and common perineal nerves. This division may take place at any point between the sacral plexus and the lower third of the thigh. When it occurs at the plexus, the common perineal nerve usually pierces the piriformis. In the upper part of its course, the nerve rests upon the posterior surface of the ischium, the nerve to the quadratus femoris, the obturator internus and gemelli, and the quadratus femoris. It is accompanied by the posterior femoral cutaneous nerve and the inferior gluteal artery, and is covered by the gluteus maximus. Lower down it lies upon the adductor magnus and is crossed obliquely by the long head of the biceps femoris. The nerve gives off articular and muscular branches. The articular branches, rami articulares, arise from the upper part of the nerve and supply the hip joint, perforating the posterior part of its capsule. They are sometimes derived from the sacral plexus. The muscular branches, rami muscularis, are distributed to the biceps femoris, semitendinosus, semimembranosus, and adductor magnus. The nerve to the short head of the biceps femoris comes from the common peroneal part of the sciatic, while the other muscular branches arise from the tibial portion, as may be seen in those cases where there is a high division of the sciatic nerve. The tibial nerve, N. tibialis, internal popliteal nerve, the larger of the two terminal branches of the sciatic, arises from the anterior branches of the fourth and fifth lumbar and first, second, and third sacral nerves. It descends along the back of the thigh and through the middle of the popliteal fossa to the lower part of the popliteus muscle, where it passes with the popliteal artery beneath the arch of the soleus. It then runs along the back of the leg with the posterior tibial vessels to the interval between the medial malleolus and the heel, where it divides between the laciniate ligament into the medial and lateral plantar nerves. In the thigh it is overlapped by the hamstring muscles above, and then becomes more superficial, and lies lateral to and some distance from the popliteal vessels. Opposite the knee joint, it is in close relation with these vessels, and crosses to the medial side of the artery. In the leg it is covered in the upper part of its course by the muscles of the calf, lower down by the skin, the superficial and deep fascia. It is placed on the deep muscles, and lies at first to the medial side of the posterior tibial artery, but soon crosses that vessel and descends on its lateral side as far as the ankle. In the lower third of the leg, it runs parallel with the medial margin of the tendo calcaneus. The branches of this nerve are articular, muscular, medial sural cutaneous, medial calcaneal, medial, and lateral plantar. Articular branches, rami articularis, usually 3 in number, supply the knee joint. 2 of these accompany the superior and inferior medial genicular arteries, and a third the middle genicular artery. Just above the bifurcation of the nerve, an articular branch is given off to the ankle joint. Muscular branches, rami muscularis, 4 or 5 in number, arise from the nerve as it lies between the 2 heads of the gastrocnemius muscle. They supply that muscle and the plantaris, soleus, and popliteus. The branch for the popliteus turns around the lower border and is distributed to the deep surface of the muscle. Lower down, muscular branches arise separately or by a common trunk and supply the soleus, tibialis posterior, flexor digitorum longus, and flexor hallucis longus. The branch to the last muscle accompanies the peroneal artery. That to the soleus enters the deep surface of the muscle. The medial sural cutaneous nerve, nervus cutaneus suri medialis, nervus cumanicans tibialis, descends between the 2 heads of the gastrocnemius and about the middle of the back of the leg, pierces the deep fascia, and unites with the anastomotic ramus of the common peroneal to form the sural nerve. The sural nerve, nervus suralis, short saphenous nerve, formed by the junction of the medial sural cutaneous with the peroneal anastomotic branch, passes downward near the lateral margin of the tendo calcaneus, lying close to the small saphenous vein, to the interval between the lateral malleolus and the calcaneus. It runs forward below the lateral malleolus and is continued as the lateral dorsocutaneous nerve along the lateral side of the foot and little toe, communicating on the dorsum of the foot with the intermediate dorsal cutaneous nerve, a branch of the superficial peroneal. In the leg, its branches communicate with those of the posterior femoral cutaneous. The medial calcaneal branches, rami calcaneae medialis, internal calcaneal branches, perforate the laciniate ligament and supply the skin of the heel and medial side of the sole of the foot. The medial plantar nerve, nervus plantaris medialis, internal plantar nerve, the larger of the 2 terminal divisions of the tibial nerve, accompanies the medial plantar artery. From its origin under the laciniate ligament, it passes under the cover of the abductor hallucis, and appearing between this muscle and the flexor digitorum brevis, gives off a proper digital plantar nerve, and finally divides opposite the bases of the metatarsal bones into 3 common digital plantar nerves. Branches. The branches of the medial plantar nerve are 1. Cutaneous, 2. Muscular, 3. Articular, 4. A proper digital nerve to the medial side of the great toe, and 5. 3 common digital nerves. The cutaneous branches pierce the plantar aponeurosis between the abductor hallucis and the flexor digitorum brevis, and are distributed to the skin of the sole of the foot. The muscular branches supply the abductor hallucis, the flexor digitorum brevis, the flexor hallucis brevis, and the first lumbriculus. Those for the abductor hallucis and flexor digitorum brevis arise from the trunk of the nerve near its origin and enter the deep surfaces of the muscles. The branch of the flexor hallucis brevis springs from the proper digital nerve to the medial side of the great toe, and that for the first lumbriculus from the first common digital nerve. The articular branches supply the articulations of the tarsus and metatarsus. The proper digital nerve of the great toe, nervi digitalis plantaris proprii, plantar digital branches, supplies the flexor hallucis brevis and the skin on the medial side of the great toe. The 3 common digital nerves, nervi digitalis plantaris communes, pass between the divisions of the plantar aponeurosis, and each splits into 2 proper digital nerves. Those of the first common digital nerve supply the adjacent sides of the great and second toes, those of the second the adjacent sides of the second and third toes, and those of the third the adjacent sides of the third and fourth toes. The 3rd common digital nerve receives a communicating branch from the lateral plantar nerve. The first gives a twig to the first lumbriculus. Each proper digital nerve gives off cutaneous and articular filaments, and opposite the last phalanx sends upward a dorsal branch, which supplies the structures around the nail, the continuation of the nerve being distributed to the ball of the toe. It will be observed that these digital nerves are similar in their distribution to those of the median nerve in the hand. The lateral plantar nerve, nervus plantaris lateralis, external plantar nerve, supplies the skin of the 5th toe and lateral half of the 4th, as well as most of the deep muscles, its distribution being similar to that of the ulnar nerve in the hand. It passes obliquely forward with the lateral plantar artery to the lateral side of the foot, lying between the flexor digitorum brevis and the quadratus plantae, and in the interval between the former muscle and the abductor digiti quinti, divides into a superficial and a deep branch. Before its division it supplies the quadratus plantae and abductor digiti quinti. The superficial branch, ramus superficialis, splits into a proper and a common digital nerve. The proper digital nerve supplies the lateral side of the little toe, the flexor digiti quinti brevis, and the 2 interosii of the 4th intermetatarsal space. The common digital nerve communicates with the 3rd common digital branch of the medial plantar nerve and divides into 2 proper digital nerves which supply the adjoining sides of the 4th and 5th toes. The deep branch, ramus profundus, muscular branch, accompanies the lateral plantar artery on the deep surface of the tendons of the flexor muscles and the adductor hallucis, and supplies all the interosii except those in the 4th metatarsal space, the 2nd, 3rd, and 4th lumbricules, and the adductor hallucis. End of section 41.